Good afternoon and welcome to the Assembly Committee on Health and Human Services. Secretary, will you please call roll?
Assemblymember Dahlia.
Here.
Edgeworth.
Present.
Gonzalez.
Here.
Goulding.
Here.
Gray. Hafen. Hibbets. Hunt.
Here.
Jackson. Koenig. Nadeem.
Present.
Wen.
Here.
Orntlicker.
Here.
And Chair Brown May.
Here. Thank you so much. Please mark our members present when they arrive. I know that they're probably running from other meetings. This is a time of session when we are running all over trying to make sure we get everything heard. A couple of housekeeping items. As a reminder, please silence your electronic devices. If you wish to testify, sign in, and then give your business card to the secretary. Members of the public may provide a public testimony on a bill either in person or by telephone. To do so by telephone, you will dial 888-475-4499, and then when prompted, provide the meeting ID, which today is 852-534-29050, and then enter the pound sign. Meeting agenda and committee information is available online, as well as our YouTube channel. A public comment will be taken today at the end of our meeting. And as a reminder, please be courteous and respectful in all of your interactions. And also, committee members will be using their laptops or other electronic devices. Please don't take this as a sign of disrespect. They're reviewing information online. We do have 3 bills on our agenda today. We're going to take them out of order. Thank you to our distinguished senators for being with us in the room today. So the lay of the land, we will start with Senate Bill 188. And then we'll move into Senate Bill 183, and then we will end with Senate Bill 24. So if you are following along on the agenda, you will have an idea of how we're moving. With that, I will officially open the hearing for Senate Bill 188. We will welcome Senator Donyate and his team to the table. You may begin whenever you're ready.
Thank you, Chair, and good afternoon to the members of the Assembly Committee of Health and Human Services. For the record, my name is Fabian Donyate, and I represent Senate District 10 in Las Vegas. Today, I come before you to speak on Senate Bill 188, a bill that will ensure meaningful access to language services and safeguarding Nevada children from being asked to facilitate conversations beyond their maturity level. Today, I'm joined by my intern, Leticia from UNLV, to present on this bill. So, Leticia, please go ahead and take it away.
Thank you, Senator Donyate, and thank you to the Assembly Committee on Health and Human Services for giving me an opportunity to present. My name is Leticia Delgado, that's Leticia-Delgado for the record, and today we're going to cover the bill language, the background, national trends, and solutions relating to Senate Bill 188. So, Senate Bill 88 is an act relating to healthcare. It requires certain healthcare facilities and providers of healthcare to take reasonable steps to provide a person with limited English proficiency with language assistance under certain circumstances. It prescribes requirements governing the use of interpreters and translators to comply with that requirement, and it authorizes the discipline of certain healthcare facilities and providers of healthcare for certain violations. So today I want to begin by contextualizing the current state of representation in the healthcare workforce. Nevada is home to a diverse range of ethnicities and languages, with 29.3% of residents speaking a language other than English at home. However, our healthcare workforce does not always reflect the significant ethnic diversity. The most notable gaps are found within the Latino community, where only 1% of medical graduates are Latino, despite this group making up 29.9% of the population. These disparities are even more apparent for the deaf community at a national level, where data indicates that 3% of physicians have a disability and only 12 of those disabilities are deaf or hard of hearing. A number of children are tasked with interpreting legal and medical documents for their parents, and in some families, the ability to translate for your parents is viewed as a rite of passage or a source of pride. However, the reality is that children lack the life experience necessary to convey such important information. Children are unable to preserve tone and nuance in translation, but trained professionals are equipped to do so effectively. The federal government acknowledges this challenge and addressed it through the Section 1557 of the Affordable Care Act. This section prohibits children from serving as interpreters or providing language assistance to individuals with limited English proficiency. It applies to health programs or activities that receive direct or indirect federal financial assistance from the Department of Health and Human Services, including to, but not limited to, state Medicaid agencies, Medicare, health insurance plans, and most hospital and healthcare providers. While many states have largely overlooked this provision, some, such as Alabama and Maine, have codified the protection of underage interpreters into their state laws. Nevada, despite being the third most diverse state in the country, has only 12 provisions related to effective communication in healthcare, and none of these provisions actually offer protection for children in these situations. With the background of the bill in mind, I will now hand it over to Senator Doñate to provide an explanation of the bill. Thank you.
Thank you so much, Leticia. So again, Senate Bill 1888 is something that is codifying what the Affordable Care Act requires federally. Essentially, we're looking at making sure that people, when they come to the doctor's office, they have the adequate services to be able to receive the care that they need for whatever situation they come forth. The most important discussion with this is, so personally, I think I've talked to you, many of you before about my personal circumstance, but I was the one that had to translate for my father when he was diagnosed with type 2 diabetes. I think that ultimately the healthcare system shouldn't have ever put me in that situation, and there are many more situations that are probably more severe than what I had. Luckily for me, right, or fortunately and unfortunately, the condition that I translated for my dad was his type 2 diabetes diagnosis. But if I was the one that had to deliver for him the news that he had cancer or was terminally ill, I can't explain the level of trauma that someone like myself would have, or other children that are doing this every day. And so this is codifying already what is required via federal law. I want to make that clear. And it looks at making sure that we're closing the disparities that people will receive when they come into the doctor's office. And just as a disclosure, before we're taking any questions, we're looking at specifically facilities-based. I know there's other parts of the healthcare system that we often look at, particularly with EMS and so forth, but we're only looking at when people come into the healthcare system, specifically with facilities and their communication with doctors and providers of care. So that concludes our presentation, and we're happy to answer any questions.
Thank you. Thank you for your presentation. Members, are there questions? Go ahead, Assemblymember Hibbets.
Thank you, Chair. Thank you, Senator. I have a question. In Section 8 and Section 19, it says that an interpreter or translator is qualified to provide interpretation, and then lists certain criteria. But who makes the determination whether or not they are proficient in understanding of spoken, written English, and at least one other language, has demonstrated proficiency? Who's the agency or entity that is going to determine whether or not that situation exists?
Thank you so much, Assemblyman Fabian Doñate, for the record. So, so just for everyone's questions that we're going to be receiving today, this was copied verbatim based of how the Affordable Care Act right now currently requires. So we are just codifying what is already required into federal law. For this specific section, it's the health facility that would be the one that would be responsible to determining whether or not that person has the ability to essentially provide that level of service. So we wanted the law to be as flexible as possible because technology is changing, as we know. When we did the hearing in the Senate side, right, we had the live transcription, which we've seen throughout this session. And so I did not want this bill to be prohibitive in terms of what technology is already doing, whether it's Google Translate all the way to the services that we use in this state. But in terms of the staffing that would be able to be qualified, that's more of a health facility structure, right? What we're trying to prevent is the malfeasance of folks being put, essentially, for example, utilizing a child to be able to translate. The bill goes into specifics of certain situations where that would be permissive, so like if it was an emergency and so forth. But it's more at the it's more at the facility level versus macroscopically, if that's to answer your question.
Next question from Assemblymember Nadeem.
Thank you, Madam Chair. Thank you so much for the presentation. I just wanted to make it clear, is that bill represent both the hospitals and the clinic areas, facilities covered under that?
Thank you so much, Fabian Doñate, for the record. So yes, Section 3 of the bill defines of where a health facility and is defined, and so it would be referenced based on who oversees them. So if you're a physician and MD, it would be to the Board of Medical Examiners to investigate such claims. So it just depends on who the authority is, but provisions of this bill, as it was drafted for the Affordable Care Act, is looking at health facilities specifically.
Okay.
So it depends on what type of provider of care you are. Yeah.
Okay. Thank you.
Thank you. Next question from Assemblymember Goulding.
Thank you, Chair. Thank you. Can you, are any languages required to be translated, or is there some limit on how many languages or what percentage of the population needs to be covered, be represented in the translation services? I'm not asking that very succinctly, but by your nodding, it sounds like you know what I'm asking.
Thank you, Assemblywoman Fabian Iñate, for the record. So correct. So in part of the amendments, the tweaks that we made from the Senate to the Assembly was that the hospital or the clinician, right, would do to the best extent possible. So obviously, the most prevalent languages that we're probably going to be seeing in Nevada is probably those that are speaking Spanish or Tagalog, right? And so, would we be able to cover all of them? No, I don't think that's feasible, but it's to the extent practical, right? And so there are flexibilities in the bill that was drafted already as part of the Affordable Care Act provisions that allow to the best extent that we can. And I wouldn't necessarily say that if you didn't meet every single language that you would be punished under this law. That's not the intent of this. It's providing the flexibility as much as we can when we can do it, right? An example that came up is if you're in the rurals, right? And obviously we know that bandwidth technology or broadband is not as equipped in the rurals as it is in the urban areas. So what happens if there's a lag of time or so forth? The amendments that we put in the bill allow for that flexibility so long as you're using the best that you could at that current moment.
Thank you. Next question, Assemblymember Gray.
Thank you, Madam Chair. Good afternoon, Senator Iñate. Question. So if this is already codified in federal law under the ACA, why do we need to add it into NRS?
Thank you so much, Fabian Iñate, for the record. That's an excellent question. Number one, I would approach it in two ways. Number one, oftentimes what we see with federal law is that there's not a compliance with the individuals that here locally, right? So we've seen very similar instances where the federal government says through CMS that you have to follow such guidelines, right? We all have to follow them because it's part of federal law, but there's no punitive measure or enforcement mechanism at the local level to ensure that folks are complying with it. And then number two, it allows for the reason why it's important to codify it into state law, because it's already federally, is because it ensures that our providers understand that there's a continuation of whatever federal policy changes to. So at least there's a guideline of if the federal government were to say we're not going to do this anymore, or we're going to do something more conducive to what we're doing statewide, right? This at least establishes a baseline as to what we require for our patients. And obviously we're seeing a lot of changes federally with each administration, and so this is just to make sure that at the bare minimum, we should not be putting children in this situation, and we can all agree to that. So that's more of the rationale for codifying it.
Agreed. Madam Chair, following, if I could. So if the ACA is repealed, or the requirements of this portion of the ACA are repealed, would there be a trigger to repeal this portion in NRS as well, or is your intent to keep it in NRS indefinitely?
Thank you, Fabian Iñate, for the record. By passing this bill, we now have this portion of the Affordable Care Act now codified into state law, so whatever happens federally, this still exists. So children would not have to be put in these situations, regardless of what happens nationally.
Thank you.
Thank you. Members, any other questions? No, thank you. I do have one. There was a late comment that was received. I'm curious to know if you will look at section 20, which is on page 11. It identifies that a provider of healthcare who violates any provision of sections 15 to 20 inclusive of this act is guilty of unprofessional conduct. What's the definition of unprofessional conduct? I'm just curious to know where this language comes from.
Thank you so much, Fabian Iñate, for the record. So this was what my understanding of this section of the bill is that traditionally this is how we draft when it comes to punitive measures for individuals that are found for negligence and malfeasance. We have talked to NSMA of potentially taking out the unprofessional conduct language in the bill, so striking that, but that for example, if you were a physician, right, you put a child into the circumstance that the board of medical the board of medical examiners could determine what how they can discipline you if there was an effort to do so, but that it wouldn't be considered as unprofessional conduct. So that's the amendment that, if there was one, I think it is a friendly amendment that was brought to me this morning, and so I would be amenable to changing that.
Thank you for that clarification. I appreciate that. Okay, members. Is there a question? Is it actually a question?
It is. You just hit on something I'd like to hit on. If that's
Okay, short question. Thank you.
Thank you. Real quick question. So I'm not sure if the Affordable Care Act adds penalties for violation, but if it does, would they be subject to the penalties of both if there was a problem? Say they on one of the inspections, they came up and said, hey, you're not, the provider's not abiding by this portion. Would the state then levy sanctions as well?
Thank you so much, Fabian Oñate, for the record. That might be a question for legal if they're able to answer. From my understanding is this is the application of how we would enforce it via state law, so I'm not entirely sure of the duplication of what would exist federally. So,
Thank you, Senator. Mr. Noss?
Thank you, David Noss, LCB Legal, for the record. Without being an expert on the ACA and knowing exactly what penalties, if any, there are, if there were, certainly the state and the federal government could each take actions. Thank you.
Thank you for that clarification. Okay. Seeing no other questions, thank you for the presentation. We'll ask you to go ahead and step back. At this time, we will open testimony in support. If you would like to offer comments in support of Senate Bill 188, please come forward here in Carson City or in Las Vegas. Seeing no one here in Carson City, I do see someone in Las Vegas. If you will turn on the microphone, state and spell your name, and then you'll have 2 minutes.
Sorry. Good afternoon. My name is Lorraine Oliver. I'm a retired community health nurse. I'm in full support of the aspects of the bill that Senator Dagnato presented. I do believe also that sometimes we have to consider whether the person that we are using as an interpreter is not a perpetrator of violence against the client. And I also think that those rules regarding children are very, very strong and should be such. In some cases, I believe we also need to consider the cultural sensitivities. For example, I had a client who's culturally needed a female OBGYN to attend to her, and the husband got freaked out when a man came in and they had to change that, but it was still workable. I suspect that this may not be as easily accomplished in the rurals, but it will certainly be accomplished in cities, and it was in that case. And I believe I forgot to spell my name. It is Lorraine, last name Oliver. Thank you.
Thank you, Ms. Oliver. I appreciate that. Is there anyone else in Las Vegas who would like to offer testimony and support? Please come forward. If you're here, go ahead and fill those chairs in. State and spell your name. You may begin when you're ready.
Hey, good afternoon, Chair and members of the committee. My name is Bridget Choi, spelled BRIDGETTECHOI. I'm a nursing student and Korean community organizer with 1APIA Nevada. Earlier this year, I took my grandma to a local imaging center to get a DEXA scan. Although she has received the same procedure on her own in Korea, the language barrier in the States made the ordeal a bit of a challenge. It was difficult for her to completely understand both the intake form and the questions the technicians asked regarding her medical history. I've been fortunate enough to spend many years with my grandma, but I'm far from familiar with her medical history in its entirety. At the time, I was concerned that my hodgepodge explanations were inadequate for her, or that I may have misrepresented her history on the form. Medical terminology can be difficult even for native English speakers, so a language barrier makes an already daunting task seem impossible. This responsibility should fall onto the shoulders of trained professionals who are familiar with medical terminology in both languages. The Asian American, Native Hawaiian, and Pacific Islander community is one of the fastest growing populations in Nevada. Nearly a quarter of Asian Americans and 5% of Native Hawaiian and Pacific Islanders are limited English proficient. Accounting for the vast diversity in the state, it is critical that our healthcare system reflects and serves the needs of all communities. This bill will ensure that individuals with limited English proficiency will receive professional language assistance rather than relying on their children to carry the burden of interpretation. Children should never be placed in the position of translating complex medical information, especially when it concerns serious health decisions. Nevadans deserve translation services that not only deliver accurate information, but also provide reassurance during what is often a sensitive moment in their lives. SB 188 will move Nevada toward a more accessible and culturally competent healthcare system and ensure that language is not a barrier to receiving proper care. Thank you.
Thank you. Okay, seeing no one else in Las Vegas, AVH will move to the telephone lines. Is there anyone here who would like to offer testimony in support of Senate Bill 188?
If you would like to testify in support of Senate Bill 188, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 188, please press star 9 now.
Hi, this is Sarah Evans with SEIU. For all the reasons already stated, I ditto in support of this. Thank you for your time.
Caller with the last 3 digits, 246, please press star 6 to unmute your phone. You may begin.
Buenas tardes, señora presidenta y miembros del comité. Mi nombre es Alexis Esparza, se deletrea ALEXISESPARZA y soy un orgulloso miembro de SEIU 1107. Estoy aquí para testificar en firme apoyo de SB 188 y les insto respetuosamente que también lo apoyen. Gracias por su tiempo.
Chair, there are no other callers wishing to testify in support at this time.
Thank you, AVH. This time we'll move into opposition testimony. If you would like to offer testimony in opposition of Senate Bill 188, please come forward at this time here in Carson City or in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Senate Bill 188?
If you would like to testify in opposition to Senate Bill 188, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 188, please press star 9 now. Chair, there are no callers wishing to testify in opposition at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. If you would like to offer testimony in neutral on Senate Bill 188, please come forward at this time. Thank you. We'll go ahead and start here in Carson City.
Good afternoon, Chair, members of the committee. For the record, David Cherry, that's DAVIDCHERRY, Government Affairs Manager for the City of Henderson. I just want to thank Senator Donyate for making it clear that the bill's intent was to capture the services that are provided in facilities and not necessarily with our EMS providers. City of Henderson provides EMT care with our emergency medical technicians and paramedic firefighters. And we just want to make sure that in an emergency situation that we would recognize that we would be able to do what was available to us at the time, but we wouldn't want it to be an impediment for our ability to care for members of the community who need our emergency services. So thank you to the sponsor.
Thank you, Mr. Cherry. Okay, we'll go down to Las Vegas. Feel free to begin.
Good afternoon, Chair Brad May and members of the Assembly Health and Human Services Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association. We'd like to thank Senator Donate for working with us on SB 188 and appreciate him accepting our friendly amendment today on Section 20. We understand that the bill's goals is to codify federal provisions, and we think that the comprehensive amendments that have been offered help maximize tools available to medical facilities and to physician practices that help contain costs while providing patient accessibility to translation resources. Thank you.
Thank you. Seeing no one else here. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Senate Bill 188?
If you would like to testify in neutral for Senate Bill 188, please press star 9 now to take your place in the queue. Again, if you would like to testify neutral for Senate Bill 188, please press star 9 now. Chair, there are no callers wishing to testify neutral at this time.
Thank you, AVH. At this time, we'll call our bill sponsor back up. No closing comments. We're being waived off, so we will officially close the bill hearing for Senate Bill 188 and thank our senator for being here. That moves us to item number 2. We will officially open the bill hearing for Senate Bill 183. We will welcome forward Senator Scheibel and her team. Feel free to begin when you're ready.
Thank you, Chair Brown-May. I think we do have a couple of presenters joining us by Zoom. And it looks like we have at least one of them up on the screen now. And so for the record, and any of you who somehow don't know already, I'm Melanie Scheibel, State Senator for District 9, and I'm very pleased to turn this presentation over to my incredibly competent and knowledgeable intern, Soraya Bonner.
Thank you, Chair Brown-May and members of this committee. My name is Soraya Bonner, S-O-R-A-I-A-B-O-H-N-E-R, and I have the privilege of being Senator Scheibel's intern for this session. Today, I will be presenting SB 183, which revises provisions relating to caseworkers of agencies that provide child welfare services, specifically foster care services. I'm also joined by experts in this field in Las Vegas who will share more of their personal and professional experience with child welfare services in our state. Under current Nevada law, there is no statutory limit on the number of children who may be assigned to a caseworker providing permanency services within an agency that provides child welfare services. Agencies have the discretion to manage caseloads internally, and while practice standards and best practices exist, there is no formal enforceable cap in statute. Senate Bill 183 seeks to change that through amending NRS 432.020 to prohibit an agency from assigning more than 30 children in custody to a single caseworker who is providing permanency services. This creates a clear statutory caseload limit for permanency workers. By being active caseloads at 30, the bill aims to improve caseworker effectiveness through ensuring that they do not become overwhelmed by unmanageable caseloads, enhance the monitoring and support of children in custody, and promote faster, safer achievement of permanency goals such as reunification, guardianship, or adoption. Senate Bill 183 also includes 2 key exceptions to the 30 child per caseworker limit, those being that sibling groups may be assigned together to a caseworker even if that results in more than 30 children on a caseload, and emergency circumstances, defined by an agency's formal policy, may allow a caseworker to temporarily exceed 30 children, but only for 30 days. The limitations in this bill do not apply to any investigations caseworkers might conduct regarding the need for protective custody of a child. The implementation of this bill will occur in stages, as agencies should begin preparation for caseload limitation upon the passage of this bill. However, in order to ensure that welfare agencies have ample time to adjust caseloads and make sure that no child is assigned a new caseworker, the full implementation of this bill will not begin until July 1st, 2026. In short, Senate Bill 183 addresses a significant issue in existing law by formally limiting caseloads for permanency caseworkers in foster care. I will now pass it over to the experts joining us in Las Vegas. Thank you.
Good afternoon. For the record, my name is Rhonda Martinez, RHONDA-MARTINES. Hello, Assembly Committee. I have been a foster parent for over 2 years. I'm also a previous Clark County Family Services caseworker for 6.5 years, and I took part in getting this bill started, and I'm happy to see that it has successfully gotten to this point. I've had the opportunity to observe firsthand the challenges around child welfare, so I'm here to express my strong support for Senate Bill 183 and its potential to improve outcomes for our children in foster care, our foster families, and the caseworkers who tirelessly oversee these cases. As a Clark County worker, I've had the opportunity to hold positions of not only just a caseworker in permanency, but as well as a kinship placement worker. And I've had the opportunity to be a part of these true successes regarding reunification, as well as the unfortunate side of casework where unification is unsuccessful. Personally, I've been a foster parent of 2 amazing boys who've gone through challenging child welfare cases that involved reunification attempts, special needs referrals, criminal justice involvement, and I firsthand witnessed overloaded caseworkers and the negative impact that it presents to both the child, biological parents, as well as the foster parents involved. When caseworkers are stretched too thin, Human error is increased and in turn leads to failures in the true safety of children and care. So if caseworkers are unable to receive those extra supports for their cases, caregivers like myself and biological parents struggle to kind of receive the true needed full support that is required. So routine child foster family contacts are rushed, communication can be minimal, and furthermore, higher caseload limits that limits that caseworker actually having to connect with the children and the foster parents and biological families. After leaving Clark County Family Services last year, I knew that I wanted to continue to improve challenges that I saw where caseworkers were overloaded, too many failed reunification attempts, and too much caseworker turnover. The great thing about my experience as a caseworker was seeing the people I worked with around me have that same passion and love for children and care. So by no means was the experience of majority bad experiences. It involved many successes within Clark County Family Services as well. With that being said, I sit here before you guys today with the most impactful cases in my head and know that there's always something we could have done better for a child as a whole. Last year, I reached out to many foster parents in the community to ask their experiences and how they think they could improve child welfare safety. I was shocked at the amount of feedback I received, but it also validated my own concerns and experiences. So after several meetings and sessions, I knew we could make a difference, and I took it upon myself to reach out to Senator Melanie Scheibel for the insight in making that change. I was honored that she listened to the community voice and dedicated herself to us in regards to this topic, that so many of other foster parents that were passionate about this as well. A case that comes to mind is my own adoptive child. His name is Rowan, and he's 2.5 years old. He's pretty much the coolest kid in his class. He wears Vans shoes and loves wearing his favorite hat backwards. He is not shy about singing his ABCs or expressing his love for mac cheese. And yes, he's excited that there's no time for the and with mac cheese. Rowan will show you nice hands. You know, he hugs you so tight. He melts your heart with his please and thank yous. And Rowan was one of my foster boys that I took in at 6 months old. Unfortunately, Rowan was physically abused only after being on an in-home safety plan with his biological parents during his 5-week stint home. And during that time, he had sustained bruising over the majority of his body, to include down his spine, both sides of his head, and in his cheeks, that someone was squeezing his mouth so tight that it ripped that perineum part of his mouth. So these injuries were documented as like multiple stages of bruising, with some up to 10 days old, if not longer. These injuries were done by people that will face the criminal justice system, but Rowan deserved better from us sitting here and standing here today in regards to this bill. I can't help but think that Rowan's case could have gone differently. So I do sit here and think that even if we did do everything right, we could have done something better to stop him from having to go through that. It's a guarantee that a decreased caseload and an increased case work experience and training will help this goal to eliminate situations like Rowan's from happening to a child again in care. Rowan is home safe with us, his adoptive family now at this time, but there are so many that who are not. So again, human error and thorough work product is decreased by that stress reduction. And human error and good casework is reduced by training and experience in child welfare careers. And if you reduced a little human error, I don't think Rowan would have gone through what he did. So I do sit here in front of you as a foster parent, adoptive parent, previous caseworker, and a loving mother here in the state of Nevada, with our children's safety, permanency, and well-being at the forefront of all of our hearts. I urge you to continue to support Senate Bill 183 and move this bill forward. And I thank you so much for your time and consideration today. Thank you.
Thank you. Senator, do we have one more presenter? We do. Okay.
Good afternoon. My name is Heather Richardson, Heather Richardson, Chairperson and members of the committee. Thank you for the opportunity to speak today on a matter of critical importance: the urgent need to reduce child welfare caseloads in Nevada's foster care system. The safety, permanency, and well-being of our most vulnerable children depend on it. I have dedicated 20 years to working in foster care in Nevada. In 2021, I left Clark County Family Services in foster care and child fatalities after 16 years as a dedicated caseworker and supervisor, including 5 years doing child fatalities and legislation. I left Clark County Family Services due to the crushing caseload demand in Nevada and its impact on children and families. Unfortunately, my story is not unique. The crisis in child welfare caseloads. Nevada's child welfare system is overwhelmed. Caseworkers are burdened with unmanageable caseloads far exceeding national averages and recommendations. The Child Welfare League of America recommends no more than 12 to 15 children per worker for ongoing services. Yet Nevada's caseworkers routinely handle double or even triple that number. This is not just a problem of capacity, it's a crisis of safety. This bill recommends a cap of 30 children per caseworker, bringing Nevada in line with national averages. Research shows that high caseloads correlate directly with negative outcomes for children, including increased placement instability, longer stays in foster care, and a higher likelihood of recidivism. When caseworkers are stretched too thin, children suffer. They do not receive timely and adequate visits, necessary services for children and parents are delayed, and critical warning signs of abuse and neglect may be missed. In states that have reduced caseloads, child safety improves. For example, in Illinois, after implementing caseload reform, the state saw a 28% decrease in child fatalities and maltreatment reoccurrence. This is a life and death issue, and Nevada cannot afford to wait. Reducing caseloads saves money. Beyond the moral imperative, reducing caseloads is also a fiscally responsible decision. High caseloads lead to high turnover, which is one of the costliest inefficiencies in child welfare. The national average annual turnover rate for caseworkers is 30 to 40%. Nevada is losing millions of dollars each year due to turnover. The cost of replacing a single caseworker, including recruitment, training, and lost productivity, can be as high as $70,000 to $200,000 per caseworker. Turnover leads to case delays, more children languishing in foster care, and higher rates of reentry, all of which cost the state millions of dollars annually. A stable, well-supported workforce reduces these costs. When workers stay, children move more quickly through to permanency, whether through reunification or adoption, which ultimately reduces the financial burden on the state. For example, Missouri saw a 50% reduction in turnover after lowering caseloads, leading to millions of dollars in savings and improved child outcomes. Nevada can and must follow suit. Foster parents also leave the system due to caseload sizes. The cost of losing quality foster parents can be substantial to a state. It costs $6,000 to recruit and train a new foster parent for each one that leaves, in addition to the expenses of congregate care for a child to be placed at a facility like Child Haven. Clark County indicated in another bill before this committee that the cost of congregate care exceed the cost of placing a child in a private foster home. Children who are placed with better matched foster families due to proper caseworker attention experience fewer placement disruptions. Iowa experienced a 50% in placement disruption when caseloads were capped at recommended levels. Fewer placement moves result in better emotional and behavioral stability, making permanent reunification or adoption more successful. Lower caseloads allow caseworkers to connect families to therapy, parenting classes, and substance abuse treatment faster, preventing crises that lead to reentry. For each child in foster care, it costs taxpayers between $25,000 to $50,000 annually. Studies show that reducing time in care by just 1 month per child could save states millions of dollars annually. Further, just a 1% decrease in recidivism has been shown to save millions. States like Illinois and Alabama saw recidivism rates drop by 15 to 20% when they invested in lower caseloads. Missouri reduced caseloads and saw a 40% drop over 5 years. New Jersey reported a significant increase in foster care reentries within 12 months of reunification when they reduced the number of children assigned to a caseworker. Common sense legislation for a stronger Nevada. This is not just about compliance, it's about protecting children and making smart financial choices. Reducing caseloads will first ensure child safety by allowing caseworkers to provide the attention each child deserves. Number 2, lower caseworker turnover, reducing costly recruitment, hiring, and training cycles. 3, improve permanency outcomes, decreasing the time children spend in costly foster placements. 4, improve retention of seasoned foster parents. 5, save taxpayer dollars by preventing crises, reducing legal costs, increasing system efficiency. Number 6, improve access to service for families. And number 7, lower recidivism of children being re-traumatized by subsequent removal from their families. I urge this legislature to invest in the future of Nevada's children. Reducing caseloads allows caseworkers to move children towards permanency faster, saving the state millions in unnecessary costs while improving child outcomes. We cannot continue to ask caseworkers to do the impossible while expecting better outcomes. Reducing caseloads is not just common sense. It is life-saving legislation that will ensure the safety and success of our children. Thank you so much for your time and consideration, and I'm happy to answer any questions.
Thank you. Senator, I understand we have one more presenter. Yes, we'll ask you if you don't mind to keep your comments short to 2 minutes, and then we'll move into questions. Thank you so much. Go ahead.
Thank you to the Assembly Committee on Health and Human Services for hearing us today. My name is Donna Smith, Donna Smith, and I'm an adoptive parent of 4. I served as a foster parent and fictive kin caregiver for 11 years. I'm a co-founder and board member of Foster Change, and I'm a Clark County Commission appointee to the Citizens Advisory Committee for Clark County Family Services, where I've served since 2011. I know well the frustrations of a slow response from a caseworker, but I want to be clear. Slow responses have less to do with a caseworker's competency than with their workload. A manageable caseload means calls get returned on time, referrals get processed so the needs of children can be addressed early, and it means kinship placements are identified early. It also means that more time can be spent identifying services needed for families of origin for better support of successful reunification. It means permanency comes faster for children. I had a conversation with a CCFS manager the other day about foster parents often feeling like second-class citizens. The response to me, as it always is, was caseworkers just need more training on how to communicate with and think about foster parents. And maybe that's true, but it's more likely the concerns foster parents encounter comes from a caseworker's lack of time than it does from a lack of training. When consistently your best is never enough, good people will leave, taking with them their years of experience and institutional and child family knowledge. Services get delayed, foster parents get frustrated, caseworkers resent their efforts don't matter, and we all just throw up our hands again and complain that nothing ever changes. SB 183 changes that dynamic. It breaks the cycle, and that's what the foster care system is supposed to do, break the cycle. SB 183 means caseworkers have an opportunity to feel successful in their jobs, and they have time to get to know the children in their care and their caregivers. It means we all do better. We all feel better, and we all act better. No one, not one partner, not one service provider will be worse off because of limited child loads. Everyone thrives, especially the children. And so I ask again that you please vote in support of SB 183. Thank you.
Thank you. Thank you. Senator, does that conclude your presentation?
It does. Thank you so much. We're happy to answer questions.
Thank you so much. We do have a couple. We'll start with Assemblymember Orenlicker.
Thank you, Chair, and thank you for the presentation. This is an important need, so I'm glad you proposed it. I'm curious about section 1.4 maybe, and that is the exceptions. You've made a great case for why we need to limit caseloads, but the exceptions for people who aren't, who are being subject to an investigation, or who's not in the custody of the agency, those strike me as potentially very time-consuming cases. So does the exception in 1.4 undermine the goal of the bill too much, or why don't you think it does?
Melanie Scheibel, for the record, thank you for the question. Subsection 4 is clarifying section because we use the term caseworker to apply to people with multiple different jobs. And so generally, I don't know of anywhere in Nevada where the same person is assigned to investigating a case where a child may be removed from the custody of their parents or the person whose custody they're currently in, and the same person would be assigned to that child as they navigate the foster system and possible reunification. So the purpose here is to ensure that we are delineating between the caseworkers who have foster kids assigned to their caseload versus the caseworkers who are actually in an investigative role who might be investigating a different number of families or children and their families to determine whether or not a child should be taken into the custody of that agency that provides services.
Okay, so from your answer, it sounds like you've got a caseworker, 30 cases, is not going to be doing investigations on other kids at the same time. That's a different class of caseworker.
Melanie Scheibel, for the record, yes.
Okay, thank you.
Thank you. Next question from Assemblymember Nadeem.
Thank you so much, Madam Chair. Thank you so much for your presentation. This is such an important topic. So I'm just curious about, and I'm worried that there's so much load on the caseworkers. Why nobody ever thought about limiting it before? Do we have shortage of caseworkers, or what is the reason?
Melanie Scheibel, for the record, probably Ms. Richardson or Ms. Martinez could speak to this better, but I think the short answer is a lot of burnout. We burn out caseworkers really quickly, and so hopefully by reducing the number of cases they have, we can retain some of them longer. But I'll let those other presenters speak to that.
Heather Richardson, for the record. To give you some background or context, these conversations have been occurring between Clark County Management and the Labor Management Committee for SEIU, which represents the caseworkers, for at least the past 10 years. Overburdened caseloads have been a subject of conversation for a really long time. Unfortunately, there hasn't been made any changes, and that's why this bill is so incredibly important, because those of us that have interfaced with the system, we realize how valuable our caseworkers can, and they can't assess safety accurately if they are just overburdened and they're just one person and they can't return those calls. So I think that it's been one of the arguments made I've heard is because of budgetary reasons. And that's why during my presentation, I wanted to address those front and center with you to explain that it's less than 3% of the entire budget of Clark County DFS to staff all permanency positions at caseloads of 30. And so it's really not a large increase in the current budgeting, but we also have an issue with turnover. By the time you hire a new caseworker, another caseworker is leaving because of the caseload sizes. So I think it's a perpetual problem that continues to exist. And until we cap caseloads, we're just not going to get that turnover under control. Thank you.
Thank you. Next, we'll go to Assemblymember Koenig.
Thank you, Vice Chair, and thank you, Senator, for bringing this forward. My question dovetails on my fellow Assembly member's previous question, but I think the concept is great. A little more question on implementation, and the answer wasn't quite exactly what I was looking for. Like she talked about a little bit of budget and things, but do we have, say by limiting to 30, say we need 25% more case workers to take up all those kids that were over 30. Do we have enough caseworkers in the state to be able to pick up that slack? I mean, it sounds great, but just like, let's have a 20 class size in the schools, but if we're 1,000 teachers short, now we're 1,500 teachers short and we still don't have it. So do we have the caseworkers in the state to pick up that load?
Melanie Scheibel, for the record, I think some of the counties may come up to testify in the neutral position and may be better suited to answer that. But the short answer is that I think that we do. So there are three basic entities that employ caseworkers for this purpose. You have Washoe County, you have Clark County, and then you have the state level DHHS. And at the state level DHHS, they're already below 30 children per caseworker. So that leaves Washoe, which is also below 30 cases per caseworker. And then Clark County is the one where the caseworkers are hovering right around that 30 number. I think the last time that I met with Clark County, they had about 3,000 children in care and about 100 caseworkers. So that would be exactly 30 children per caseworker. And so that's also part of the reason that we included the emergency provision to allow for extended case, those extended caps if there is an emergency where they're not able to hire people, if there's a hiring freeze or something like that. And I'll also be honest that we would have loved to have a lower ratio. There is a national organization, the acronym for which I'm forgetting right now, that recommends caseloads closer to about 15 children per caseworker. And so we chose 30 because it is an attainable number.
Thank you. That answered my question.
Thank you. We'll next go to Assemblymember Hibbets.
Thank you, Vice Chair. And there you are. Hi, Senator. I think you pretty much answered my question, but is there a statewide average ratio of caseworkers to children right now that we're talking about? I know you said Clark County is about 30 to 1, Washoe's under that, the state itself is under that. Is there an average number that you have handy? If not, I'd be more than willing to get that number later. Thank you.
Melanie Scheibel, for the record, I don't have that number. I'll also just point out that there's also some flexibility built in here because not every case is equally difficult. And so some agencies may have particular caseworkers who are assigned to, for example, high medical need foster kids who are hospitalized. And that might be, more difficult than taking on a sibling set of 2 who are in school and, don't have the same medical needs. And so even across the state to get a ratio, I'm not sure that we'd be comparing apples to apples.
All right, next we're going to go to Assemblymember Hafen.
Thank you, Vice Chair. A lot of my questions have been answered today. And kind of what I'm hearing is it's the chicken and the egg scenario. Obviously, we've got burnout. We need more caseworkers to address this. And then I guess that one of my questions would be is do you have the data that shows kind of what other states are doing at the different levels that you could just provide to the committee later?
Yes, we do.
Thank you.
Thank you.
Thank you, Vice Chair.
Thank you. Members, do we have any more questions? Seeing none, thank you, Senator. We'll just ask you to step back and we'll go ahead and go for the testimony in support. Please remind everyone, testimony in support. You have 2 minutes to do so, and please state your name for record before you begin. Please go ahead.
Good afternoon, Vice Chair, members of the committee. For the record, Carlos Hernandez, representing the Nevada State AFL-CIO. We are in full support of the bill. Thank you.
For the record, my name is Mark Ellis, President, Communication Workers of America, Local 9413. Ditto.
Good afternoon, Vice Chair, members of the committee. My name is Aisha Goins. I'm representing SEIU 1107. I just have to put some numbers on record, and then there are members of SEIU that will be testifying. Every time a caseworker leaves the workforce, the cost to the agency is approximately 70% to 200% of the exiting employee's annual salary. When this was recorded last, Texas said that the agency cost was estimated at $54,000 per departing staff member. So I just want to put that on the record, and there'll be other SEIU members that will be testifying, but we are in support. And I want to just thank the sponsor for this bill and the importance of it. We appreciate her very much. Thank you.
Good afternoon, Vice Chair and committee members. For the record, my name is Matilda Miller. That's Mathilda Miller, and I serve as the Government Relations Director for Native Voters Alliance Nevada, and we are in strong support of Senate Bill 183. At its heart, this bill is about giving Nevada's most vulnerable children stability. This bill is a critical step towards ensuring that every child gets the time, the attention, and the consistency that they deserve. When caseworkers are stretched too thin, children are not just numbers on a list. There are lives put on hold, milestones missed, and opportunities lost. Every overloaded caseworker means another child is waiting too long for the stability and support that should never be out of reach. SB 183 is about building a system where caseworkers can do the job that they were called to do. to help children heal, to grow, and help them find permanent homes. It's about making sure that Nevada stands up for the futures of kids who have already had too much taken from them. We urge your support. Thank you.
Thank you. Does anyone else in Las Vegas Carson City wish to testify for SB 183 in support? Seeing no one come to the table, we'll go down to Las Vegas. Please go ahead and state your name whenever you're ready, and please begin.
Hi, good afternoon, Chair and committee members. I am Lorraine Oliver, a local public health nurse. My name is spelled Loraine, last Oliver. I'm in full support of this, and it's sort of amazing that we are not even asking for all we could get. They're asking for less than the recommended amount, but the recommended amount is less than 30. Could we just at least do 30, which is the minimum we could do for our little ones who, for various reasons, are in such dire circumstances? I'm in full support of particularly the foster moms and everybody who's working in that circumstance. As a nurse, I was on the other side of children who were in that system being worked on, and I'm in 100% support of those who are actually the face-to-face. The work of a case manager is such that the work you do face-to-face with your customer is much less than the work you do around that to get what you need to do. And that is very important to think about. Thank you very much for your time, and I'm in full support.
Thank you. Is there anyone else in Las Vegas would like to offer that testimony in support of SB 183? Seeing no one come up to the table, AVH, is there anyone on the line in support for SB 183?
If you would like to testify in support of Senate Bill 183, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 183, please press star 9 now.
Good afternoon, Vice Chair Wynn and members of the Assembly Health and Human Services Committee. My name is Carissa Pierce, CARISSA PEARCE, and I am the Government Affairs Manager with the Children's Advocacy Alliance. CAA is an independent voice for Nevada's children with a mission to ensure that every child in Nevada thrives. And SB 183 is a supportive bill to both families and caseworkers. As we heard today, for caseworkers, this bill is particularly addressing concerns for burnout. And burnout is about more than numbers. So caseworkers are witnessing a significant trauma, and without proper support, they are experiencing secondary traumatic stress, impacting both their well-being and their effectiveness in supporting children. We see SB 183 as an opportunity to help begin preventing and alleviating burnout. And we also hope that this policy prompts the exploring of other mechanisms to uplift caseworkers, including mental health supports, reflective supervision, and trauma-informed workplace policies. By investing in caseworker well-being, we ensure stronger, more stable relationships for children navigating the foster care system. We increase the likelihood of permanent placement for our kids and support children by ensuring that caseworkers can spend adequate time with foster families to make sure that that child is receiving every resource that they need. Thank you for your continued efforts to build comprehensive solutions that strengthen the child welfare workforce. We are in strong support of this bill.
Good afternoon, committee members. My name is Robin Franklin. That's spelled ROBINFRANKLIN, and I am a supervisor for Child Protective Services. I've worked for the Department of Family Services for almost 20 years, and I can tell you that I'm in full support of SB 183. It not only will support our children and our families that we're serving every single day, but it supports the worker. As a previous worker who had over 50 kids on her caseload, I can tell you that it's impossible. The job is impossible to do when you have that many children on your caseload. However, I believe at the detriment of my own family, I made sure that kids were seen. I made sure that kids were being taken care of. But we should also be thinking of those individuals who are doing the work, and this is one of those bills that would help us do that. So I'm in full support of SB 183, and I hope that you guys are too. Thank you. Good afternoon, Chair, Vice Chair, and members of the board. My name is Shalonda Adams. That's spelled SHA apostrophe capital LONDA ADAMS. I am a supervisor with Clark County Family Services, and I currently have 3 of my 6 staff with over 30 children on their caseload. I've witnessed them cry. They go into the bathroom in their stall so they can cry and come back out and do their job. I've witnessed them be exposed to secondary trauma. I've witnessed them working overtime. So when we talk about the fiscal impact, it's not just about the recidivism, it's also about the amount of overtime. I know for the past year, one of my team members has done about 20 hours of overtime each pay period in order that she may be able to do her job sufficiently, not necessarily efficiently, but sufficiently. And so this bill would support those workers who give tirelessly of themselves to ensure that we have safe children in our community. It is very overwhelming as a supervisor when you see people that you're in leadership over who you cannot support any further than trying to help them out with 1 or 2 documents, but that does little to nothing to suffice for the amount of work that they do have. So again, my name is Shalonda Adams, and I am in full support of Senate Bill 183. Thank you.
Caller with the last 3 digits, 246. Please press *6 to unmute your phone. You may begin.
Buenas tardes, vicepresidente y miembros del comité. Mi nombre es Alexis Esparza. Se deletrea ALEXISESPARZA y soy miembro de SIU 1107. Estoy testificando en firme apoyo a SB 183. Los trabajadores de casos en servicios de bienestar infantil están al borde del colapso, luchando cada día con cargas imposibles. SB 183 es una inversión crucial para proteger la dignidad de nuestros trabajadores de casos, el bienestar de nuestros niños y la fortaleza de nuestras comunidades. Les pido que no fallen a estos trabajadores. Apoyen SB 183 y ayuden a garantizar un futuro mejor para todos. Gracias por su tiempo.
Good afternoon, members of the committee. My name is Sarah Evans, and I am a 16-year SEIU member who works at Clark County Family Services. I'm here today testifying in support to SB 183. In January 2023, the agency had a new training academy with 27 people. 13 people have left from this academy. 9 of those were voluntary. That's a 51% survival rate. I was a supervisor of permanency at that time. I lost Ebony, Stacy, Zarko, Dustin, Ty, Carrie, Holly, and Brittany all within 2.5-year span. Mind you, I only have 6 people in my unit assigned to me. A great quote from a foster youth who aced out of the system: "My worker will always be late, disheveled, and really quite strange, but he loved me, and that made all the difference." Those workers that left truly loved their kids, and their kids loved them. When workers leave, it creates more traumatic events for a child that had already had to endure challenges most of us couldn't even comprehend. These children will grow up not having the ability to form attachments or thinking they don't have a place in this world. We can do better for our children, and by making sure that the children come first, we create a better future for all. The agency has the capability to ensure that there are reasonable caseload sizes. What they don't want is the accountability. Again, caseloads can be equally distributed fairly amongst these different zones, but unfortunately, we need a law in place to hold leadership accountable to reach their staffing ratios, because this has been such an ongoing problem. I leave you with this data. A child with a single caseworker achieves permanency 74% within a year. If you have a caseload with 2 caseworkers, the permanency achievement falls to 17%. That's very dramatic. I appreciate your time. Thank you.
Callers, if you have recently joined and would like to testify in support of Senate Bill 183, please press star 9 now to take your place in the queue. Vice Chair, there are no other callers wishing to testify in support at this time.
Thank you very much. Now we're going to go to testimony in opposition of SB 183. We're going to go ahead to Carson City. Anyone coming up? All right. Seeing and hearing none, we're going to go to Las Vegas. Seeing no movement there, we'll go back to you, AVH, for opposition on SB 183.
If you would like to testify in opposition to Senate Bill 183, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 183, please press star 9 now. Vice Chair, there are no callers wishing to testify in opposition at this time.
I think I broke the mic already. It's only my first bill. Okay, we are going now to neutral. So in in Carson City, anyone testify neutral? Seeing, hearing none, going back to Las Vegas for testimony in neutral. Seeing no one come up to the table, we'll go back to you, AVH, for testimony in neutral for SB 183.
If you would like to testify in neutral for Senate Bill 183, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral, please press star 9 now.
Yes, hello. I wanted to testify in support, CYRUS HOJJATY. Thank you so much. Ditto.
Vice Chair, there are no other callers wishing to testify in the neutral position.
Thank you very much, AVH. Senator, would you like to come back and do closing? And she said no. All right, thank you so much for being here. With that, we're going to close the hearing on SB 183, and we will go to the next bill, and the last bill on the agenda for today's hearing is SB 24, and we will invite Ms. Sullivan up to present the bill. And please restate your name, and please begin when you're ready. Thank you.
Thank you, Vice Chair and members of the committee. Bobby Sullivan. I serve as the program manager for the State Emergency Medical Services Program. This is in regards to SB 24. This is a cleanup bill. It adds emergency medical responder as a recognized pre-hospital provider into statutes, which was previously called a first responder. When previous legislation changed, the name of emergency medical responder changed to be consistent with the national standards. Emergency medical responders were omitted from the language. The state currently recognizes the certification of emergency medical responders in state regulations. However, the Southern Nevada Health District does not. This bill establishes the emergency medical responder in statutes, allowing for statewide consistency, which greatly supports our rural communities. I'm happy to answer any questions.
Wow, the bill is like 5,000 pages, and the hearing presentation is 30 seconds. All right, with that, any question from members? Well, you did such a great job that no one has a question on this booklet we have here. All right, if that's the case, then we'll go ahead and have you step back, Ms. Sullivan. Please come back more often on bill hearing. And we'll go ahead and take testimony in support for SB 24. We'll start here in Carson City, then go to Vegas. So go ahead and fill up those chairs. And please start when you're ready, and please make sure you state your name for the record. Thank you.
Chair and committee members, for the record, my name is Andrew Lee Pilbit. I'm the chairman of the United Veterans Legislative Council for the state of Nevada, representing nearly 250,000 veterans. And this was such a difficult bill, the 34 pages, but they were all with the new addition and clarification of emergency medical responder was the new part. And that's what the whole bill has throughout it. Our interest here is that it has an impact on NRS 417, which is the Department of Veteran Services. And this is in part of the bill, and that's why we're here. We're in support of the bill. Thank you.
Good afternoon, Chair and members of the committee. For the record, Ryan Beeman, representing the professional firefighters in Nevada. Thank you for the opportunity to speak in support of SB 24. SB 24 is a critical step to strengthening our emergency response and workplace protection across Nevada, particularly in our rural areas. We've had a few bills this session trying to look at our rural areas and improve our areas out there. Down in Clark County, we service, we have 10 different rural departments, and we're finding more and more a shortage of volunteers. In Clark County, we have just about 100 volunteers for our 10 rural departments. And with this new language, it would help out helping with our rural, because they have to do continuing education with EMT. This would allow them to be in EMRs, which would lessen the hours of the certifications, which would help out with them in the rural areas. So we have to find different ways to try to help out the rural areas. If not, we see ourselves throughout the state right now with the professional services or your suburban areas covering those areas for long responses. So we urge your support for the bill. Thank you.
Thank you very much. We'll go now to Las Vegas. Please begin and please state your name when you are ready.
Vice Chair Wynn and members of the Assembly Health and Human Services Committee. My name is Fred Wagar, W-A-G-A-R, and I am the Southern Nevada State Legislative Chair for the Veterans of Foreign Wars and the Benefits Protection Team Lead for the Nevada Department of Disabled American Veterans. I want to thank you for the opportunity to present testimony in support of Nevada Senate Bill 24. I want to thank the Division of Public and Behavioral Health, Department of Health and Human Services for bringing this issue forward. The legislation does provide provisions to address the unique circumstances and challenges veterans face when seeking certification as emergency medical responders by mandating the collection and reporting of key data regarding veterans in this process. SB 24 champions transparency, accountability, and the continued support of those who have dedicated themselves to service. We urge you to support SB 24. The legislation includes an investment not only in the welfare of our veterans, but also in the safety, efficiency, and resilience of Nevada's emergency medical systems. Thank you for your time.
Thank you. Now we're going to go to the phone. AVH, if you could let folks in for testimony in support of SB 24.
If you would like to testify in support of Senate Bill 24, please press star 9 now to take your place in the queue. Again, if you would like to testify in support of Senate Bill 24, please press star 9 now. Vice Chair, there are no callers wishing to testify in support at this time.
Thank you, AVH. We'll go now back to Carson City for testimony in opposition of SB 24. Anyone like to do that? Okay. Seeing and hearing none, we'll go back to Las Vegas for testimony in opposition. I don't see anyone moving there. This is such exciting presentation. We are going now back to you, AVH, for testimony in opposition for SB 24.
Thank you. If you would like to testify in opposition to Senate Bill 24, please press star 9 now to take your place in the queue. Again, if you would like to testify in opposition to Senate Bill 24, please press star 9 now. Vice Chair, there are no callers wishing to testify in opposition at this time.
Thank you very much, AVH. We'll go now back to Carson City for testimony in neutral of SB 24. Wow, no one. We'll go ahead and go back to Las Vegas for testimony in neutral of SB 24. I see folks shaking hand up there, so we'll go ahead and go back to you, AVH, on the phone for testimony in neutral of SB 24.
If you would like to testify in neutral for Senate Bill 24, please press star 9 now to take your place in the queue. Again, if you would like to testify in neutral for Senate Bill 24, please press star 9 now. Vice Chair, there are no callers wishing to testify neutral at this time.
Thank you very much. We are asking anyone to come in for closing remarks. Just for giggles? Okay, no. Oh, you are? Okay. Ms. Sullivan, please go ahead and state your name and have your closing remarks.
Thank you, Vice Chair Bobby Sullivan, for the record. And prior, I did not spell my name, Bobbie Sullivan. I appreciate this committee's offering the opportunity to present this. I think it'll standardize and make things efficient across the state.
Thank you so much. Please come back anytime, especially on a Friday afternoon. For those of you who had to catch flight, you just got what I meant. All right. So with that, we're going to thank the presenter and close the hearing on SB 24. And we'll go with the last business item for the afternoon is public comment. As a reminder, each person has 2 minutes to provide testimony. Public comment may be submitted to the committee up to 24 hours after today's hearing. Is there anyone in person wishing to give public comment in Carson City? Seeing everyone running up here, we'll go back to Las Vegas. I don't see anyone there either for public comment. We'll go back to you, AVH, for public testimony. Public comment.
If you would like to provide public comment, please press star 9 now to take your place in the queue. Again, if you would like to provide public comment, please press star 9 now. Vice Chair, there are no callers wishing to provide public comment at this time.
Thank you very much, AVH. Do you have any questions or comments from the members before we adjourn? Seeing, hearing none, all these excitement, we're going to go ahead and adjourn the meeting, and we'll see you all Wednesday. Thank you for being so